Welcome back to the Egg Whisperer Show. I'm Dr. Amy, and today I'm joined by Dr. Mark Ratner, the Chief Science Officer at Theralogix. If you've ever wondered what NAD Plus is, why it matters for your fertility, and whether boosting it could help improve your chances of success with IVF or egg freezing, you're in the right place. The topic of today's episode is boosting egg quality, what we know about NAD Plus and fertility. Dr. Ratner has dedicated much of his career to understanding the science behind nutritional supplements and their role in reproductive health. In this conversation, we're diving into the fascinating world of NAD+, Sirtuins, and how these molecules may influence egg health, ovarian reserve, and fertility as we age. Welcome to the show, Dr. Ratner. Thank you so much for joining me today. I've been looking forward to
Thank,
this conversation for a long
thank you.
time.
Thank you for having me.
You talk a lot about NAD+. That's a lot of letters and then a symbol. Can you explain in simple terms what NAD plus is and why it's so important when it comes to our eggs and fertility?
Sure. Okay. So NAD is a molecule, and it's a molecule that is present in every cell of our body. Okay. People think of this as a supplement, but it's not really a supplement. It's something that we naturally have in our cells. And it stands for NAD stands for nicotinamide adenine dinucleotide, but don't have to worry about that long-winded name. We make NAD in our cells from niacin, which is vitamin B3. And so NAD in our cells has two main, really, really important functions. It actually stands sort of right in the center of literally hundreds of important chemical reactions in our cells. But all of those reactions, they break down into sort of two big categories. One is energy production. So NAD is really, really important for producing energy in our cells. That happens in the mitochondria. Okay, you may remember from high school biology. That's where the energy is produced in our cells in the mitochondria. The other thing that NAD does, okay, is it activates certain very key enzymes in our cells. What do the enzymes in our cells do? Enzymes are sort of like the workhorses in our cells. Enzymes basically make all the different reactions happen. And it turns out that NAD is required for certain very important enzymes to be activated. So, what happens though is as we get older, the amount of NAD in our cells gradually declines. And so, all of the interest for the past several years has been in can we boost the amount of NAD in our cells and restore sort of youthful levels of NAD.
Yeah, NAD cells in our brain, cells in our ovaries, cells in our uterus.
Absolutely.
Very
Absolutely.
important topic. Okay, so let's talk about sirtuins because I think a lot of listeners, this might be the first time that they're hearing this word. That's a new word for so many of us. What are they? And how do they play a role in egg supply and egg quality?
Okay. So sirtuins are a group of 7 enzymes. There are 7 sirtuins. Okay. And the sirtuins are really the master regulators of cellular metabolism. Okay. Each of those 7 performs different jobs, different functions. Okay. And we call them SIRT1, SIRT2. When I say SIRT, I mean SIRT1, SIRT. That's the abbreviation. So the SIRT1, SIRT2, SIRT3, all the way up through SIRT7. Okay. Those enzymes, which are critical for all kinds of functions in the cell, are activated by NAD. So NAD and sirtuins work together.
So they're
And
friends.
they are absolutely friends. Although, as sirtuins get activated, they gobble up NAD. They are one of the reasons as we get older and we have more and more sirtuin activity in our cells that NAD levels start to go down because the activation process breaks down NAD. Okay. The reason we're super interested in sirtuins and specifically SIRT1, the first sirtuin, okay, is because it appears to be in charge of ovarian reserve. And just like NAD, as we get older, the amount of sirtuins in our cells goes down. And because the sirtuins require NAD for activation, as NAD goes down, it's sort of a double whammy. Okay. Sirtuin levels are dropping, but then their activation partner, NAD, is also dropping. And so this is why there's so much interest now in whether we can boost NAD levels in our cells and sirtuin levels in our cells. Specifically, in terms of ovarian health, we're looking at Sirt1, the first sirtuin.
Yeah. Age is damaging to eggs. There's no doubt about it. And I wish there was a way that we can make it reversible and not inevitable, that as a woman grows older, her eggs get damaged by age. So I think that I want everyone to know about this. And I think it's so important that patients learn about this so that they can start supplementation, even if they're not considering fertility treatment or IVF. I mean, there's a possibility, I think, that women who take NAD supplements, like OVA NAD Plus, for example, that their menopause might be later. They might have less miscarriages later, and their eggs might be healthier at an older age. And I hate to use the word older because, like, a 37-year-old is not old by any means, but we know that her eggs can behave older. So, how does the natural decline in NAD plus as we get older connect to the decline in egg quality and ovarian reserve? I mean, you mentioned that it goes down, but
Right.
can you be more specific about how it's connected?
Sure. So, for an egg to develop properly, it requires a huge amount of cellular energy. There's a concept, and I don't want to get too deep into the weeds here, but one of the things that makes egg quality decline as women get older and older is that the number of chromosomes in the egg can become abnormal. We normally are supposed to have, right, in our regular body cells, we have 46 chromosomes, 23 pairs. When sperm and egg come together, they each are supposed to have 23. So you put 23 and 23 together, and you end up with a baby that has 46. But in order for those eggs to end up with 23 chromosomes, okay, requires a huge amount of energy. And in fact, remember I said mitochondria is where the energy production occurs, right, in our cells. And the single cell in the human body that has more mitochondria than any other cell is the egg. The egg has more energy production requirements than any other cell in our body. And what happens is, as those eggs get older and older and older, the ability to produce that energy decreases. Why does it decrease? Well, we know one of the things that we can do to help improve energy production in that developing egg is we can supplement coenzyme Q10, right? Because that's part of the energy production process. The molecule that actually starts the energy production process is NAD. And if NAD is declining as those eggs get older and older, okay, energy production is suffering. So if we can restore better energy production in these older eggs, we're going to end up with better eggs. And the way that we do that is by raising NAD levels in the egg, in the follicle, which is where the egg is developing, inside the ovary.
Yeah. Yeah. So I learned about NAD from a patient of mine. She had been through several cycles of IVF and came to me for another cycle, and she had this incredible cycle, and it just didn't make sense. You know, she had several cycles unsuccessful, and then all of a sudden this beautiful cycle that, had I not known that they were her own eggs, I would have thought that, like, she had used donor eggs. It just, like, knocked my socks off. And I asked her, and she's a PhD scientist. I said, "What did you do differently? Like, I need to know. What did you do?" And she said, "Well, I read an animal study showing that NAD plus supplements can improve egg health." So can you talk a little bit more about what we know so far about whether this could be true for women trying to conceive?
The studies that were initially published that have really been the bulk of what's been published have been mouse studies. Okay. Why do they use mice for these studies? Well, the mouse is a terrific model for doing reproductive research, especially ovarian aging research. And the reason is because mice only live for 2 years. That's it. They are fertile at 8 weeks. A mouse can start having babies at 8 weeks. But there are some real similarities between mice and human women, okay, in terms of ovarian function, such as women are born with all of the eggs that they're ever going to be able to make already in their ovaries. That's what we call the ovarian reserve. It's kind of what's in the bank, right? Same thing with mice. And as women get older, the number of remaining eggs starts to decline and it gets lower and lower and lower. And we say that we're losing ovarian reserve, diminished ovarian reserve. Mice experience the exact same thing. The other thing is this concept of chromosomal abnormality. What we call, the name for it is aneuploidy. That means that if enough energy is not present as that egg is developing, it's going to end up with the wrong number of chromosomes. Instead of 23, it might have an extra one, 24, or it might be short one. It could only have 22. That happens to women past the age of 36, 37, 38. That risk of abnormal chromosome content in the egg really starts to go up. Same exact thing with mice. It starts at about 8 months with mice. So there's all of these parallels. And so the first studies that have been done looking at NAD boosting have used mice. They've typically given them anywhere from 4 weeks to 4 months of supplementation. They start it usually at about 8 months because in a mouse, in an average normal mouse, by 18 months, they're not ovulating anymore. They've gone through mouse menopause. But with these studies, what they discover is that if you boost their NAD content in the ovaries, they keep ovulating past 18 months. And the egg quality is much better. So you don't get that aneuploidy. You don't get those abnormal chromosome numbers to the same degree if you can boost NAD levels in mice. Now, there's finally been a human study published. Actually, it was presented as an abstract, what we call an abstract presentation, at a big European fertility meeting back in June. And they looked at 50 women who were going through IVF. These were women who had diminished ovarian reserve. They either had very low AMH, under 1, or what we call the antral follicle count was under 5. Okay. And many of your listeners, I'm sure, are very familiar with those kinds of tests. And half of those 50 women got NAD boosting. Okay. They took a supplement to boost their NAD. The other 50 were, it was 25 NAD boosting, the other 25 were controls. And it turns out that the group that got NAD boosting had a doubling of their fertilization rates and a doubling of their clinical pregnancy rates. So this was a small study, and it was just presented as an abstract. There's a lot of information in that abstract that we're hoping to still get when they publish the full study. But it's an indication, this is a short-term benefit of NAD boosting. And so what that tells us is if you do NAD boosting, if you take a supplement to boost your NAD for maybe 4, 5, 6 weeks prior to an egg retrieval, okay, that may be enough to improve the quality of that egg.
Yeah, that's what I tell my patients, to take it at least 30 days before you start stimulation. I wonder if the mice have menopause. Do you know? Do those little mice, do they have hot flashes?
And they get very grouchy. That's right.
Very grouchy, very spicy. So there are people who don't like to take pills, they want to avoid supplements. Is there anything that women can do with diet and lifestyle that will boost NAD without taking a supplement?
So it's a great question. And so what we really are focused on is not just NAD, but boosting NAD and Sirtuins, right? And it turns out that the studies that have shown the most consistent elevation of NAD levels and Sirtuin levels without taking pills are what we call caloric restriction studies. They started off doing these things in mice and worms, and now they've actually done it in primates and mammals. Okay. If you take a mouse, remember I said a typical mouse lives 2 years, 24 months. right? If you restrict their caloric intake for their whole life, and you do it to about 30 to 40% of caloric restriction, they'll live to 36 months. You
Wow.
will actually extend their lifespan by about a third. And the way that that's happening is because NAD levels and Sirtuin levels are going up. So caloric restriction is a way to do it, but not an easy thing to do. To try and restrict somebody's caloric intake that severely for a long period of time is just not fun and not really feasible. And so what we use in OVA NAD Plus to try and raise sirtuins and raise NAD are two different supplements. I should mention, and this is a real important thing, there are products out there which are actually NAD in supplement form. The problem is that you can't absorb it. NAD as a supplement cannot be absorbed from the stomach. And even if you do absorb a little bit of it, it won't get into your cells very well. What you have to take instead is a precursor. You have to take one of the compounds that the body then converts into NAD. And this is what is in OVA NAD, the product. It's called nicotinamide riboside. And it has been shown to be extremely effective in raising tissue NAD levels in really just 6 to 8 weeks. Okay, those levels will jump up. In terms of sirtuins, we use something called pterostilbene, which is what's in OVA NAD. Pterostilbene is an analog of resveratrol. Some people have heard of resveratrol. You can get it from grape skins. Resveratrol in the lab boosts sirtuin production. Okay. But again, the problem with resveratrol is tough to absorb. The bioavailability is not good. So pterostilbene is sort of resveratrol with one extra little molecule, and it works just like resveratrol, except it's well absorbed, highly bioavailable, and it boosts SIRT1. Remember, that's the one that functions in the ovary. Sirtuin 1, SIRT1.
Yeah. And I imagine that the word is out. Like doctors know about this. Are you seeing more and more fertility specialists recommending NAD to their
Yeah,
patients?
we work with probably somewhere near 70% of the IVF practices in the country use at least one or more of our products with patients. And so we've got the ability to really reach out and survey the specialty. And we did that earlier this year. We surveyed about 400 IVF docs around the country and we asked them, are you familiar with the science behind NAD and sirtuins for female fertility? And a third of them said yes, 1/3. So we were surprised because it's not universally understood yet, but it's growing. And of the third that we got yeses from, we said, okay, are you using this with patients? And half of them were.
Hmm.
So there is, I think, a growing awareness, and that's part of our job is to get the science out there, let
Yeah.
people understand how it works, why it works, and what the situations are that it might be best used in.
Yeah. I mean, I think that, it took a while for doctors to recommend CoQ10. And I feel like everyone tells their patients, take CoQ10. And I'm hoping that they'll also say and include NAD. That's my hope because I've been using it for years. I think the results are phenomenal.
I think the analogy is perfect. What was a big challenge with CoQ10 was that, when they first started doing CoQ10 studies in female fertility, it was in mice. They used mice the same way that they're using mice in NAD research, right? And then when they turned around and said, okay, let's do some studies in women, it was really, really hard to get those studies done. And the reason is because when you do a clinical trial like that, and it's what we say placebo controlled, which means let's say you're going to enroll 100 couples in your study, and 50 are going to get NAD boosting or NAD and sirtuin boosting, and the other 50 are going to get sugar pill placebo, right? You've got to disclose that to them. You have to tell them, listen, there's a 50% chance that you're going to not really get the real thing, okay? So if you're going into a clinical trial for a new drug that's being developed, there's no way you can get that drug except in that clinical trial. And so if it's a 50% chance of getting placebo, you might be willing to take that chance. But with supplements, if I say, hey, CoQ10, 50% chance you're going to get placebo, most people are going to say, you know what? I can buy this online or I can go to the drugstore and buy it. I don't want to be in your study. Thanks anyway.
Right.
So it's
Right.
very, very hard to enroll clinical trials and get subjects into clinical trials in the fertility world.
Right.
But they are succeeding at it in China. There are now 6 placebo-controlled clinical trials that have been done in China with CoQ10. And when you put the data all together, this was actually published last year. When you combine the data from all of those 6 trials, you basically get an 84% increase in clinical
Wow.
pregnancy rate. Yeah, with
Wow.
CoQ10 supplementation.
That's
So
impressive.
I think it's a similar story. And we are actually working to try and get a clinical trial going in actually Australia for looking at NAD and Sirtuin boosting. And we're going to be looking at trying to slow the loss of ovarian reserve. And this gets back to what I was saying at the outset, and that is there's really 2 ways that this product can sort of be employed. The first is if you're going through an IVF cycle, if you're planning to freeze your eggs 6 weeks before you're going to have the egg retrieval, get started on this because energy production can be boosted in the ovary. Egg quality can really be boosted in that shorter period of time. However, there's also a long term way to use this type of product, and that is for women who maybe are not prepared to freeze their eggs. They can take something like this, and by raising their sirtuin levels on an ongoing basis, they may be slowing down the loss of eggs from that supply, that
Right.
that ovarian reserve.
Yeah, that's my theory. All the 20-year-olds, I told them, when you're 50, I should still be here. I want you to let me know if you're in menopause yet. Because I told them, I said, take your NAD, take your CoQ10 until you're done having babies and maybe beyond. And
Yeah.
I'd be super curious to see if my theory is right. Safety is a big thing. Like people want to make sure that the supplements they're taking are safe, and the side effect profile is good. Can you speak on that?
Both components in this particular product, nicotinamide riboside, which boosts the NAD, and pterostilbene, which boosts sirtuins, have a terrific track record of safety and tolerability. In fact, they have been used in human clinical trials at doses far higher than what we've even included in a product with total safety. And side effects are really pretty minimal. I think the safety question is we're pretty comfortable with that. Absolutely.
Yeah. I mean, I even tell my patients to take it in the first trimester. Listening to my podcast is not a replacement and it's not a substitute from advice from your own physician, but I do tell my patients to take it until at least their heartbeat ultrasound because I think there might be a benefit in terms of reducing miscarriage risk. That's just another theory of mine. So there's a lot of exciting research and we talked about it. What else do you think we might learn in the next few years that could help people grow their families related to NAD and fertility?
It's a good question. And I'm not sure that you really don't know what's around the corner.
Yeah.
I think that part of the challenge in these kinds of studies is that they take a long time to do. In when you're talking about couples, human couples, okay, and women, a mouse is only going 2 years, but a woman, it's going to be a 40 or 50-year process to go through their reproductive lifespan. So I think what we need to do is come up with some ingenious, some clever ways of measuring these things with what we would call substitute endpoints. And because most most of the clinical trials that are done in fertility, what's the outcome? What's the measurement that you want to make at the end of that clinical trial? You want pregnancy rates, you want live birth rate, right? But those trials they take a long time to do. They're very expensive to do because you need to enroll many, many, sometimes hundreds of couples. And given the way NIH funding uh, has essentially come under fire, trying to get those kinds of studies done has become even more difficult.
Yeah. I mean, I'd be curious to see studies on NAD and male fertility potentially.
Great
That's
question.
an interesting topic for me.
Great question. Yeah. The data is somewhat mixed. And I think that is an easier thing to measure. Okay.
Right. For so many reasons.
Yes. Okay. To get a woman's egg and see how that egg looks genetically, chromosomally, is not easy. I mean, you've got to do an egg retrieval, right? If you really actually want to examine the egg. Sperm, a lot easier. And, we didn't mention this at the outset, but by training, I'm a urologist. And when I was in my fertility practice, I was working very closely with IVF practices around the mid Atlantic, but I used to be basically doing the male part of it. But because it's a couple's issue over the course of 20, 25 years of practice, you basically have to become expert in every aspect of it. So, why is the data mixed on male? Because there are a couple of studies that seem to show that sperm quality improves if you increase NAD levels in the semen. But there was a study just published last year, and this was a strange study. They looked at men who had normal semen analyses. In other words, these were guys who weren't coming in because they had a problem. They took guys who had normal semen analyses and then they ranked them in terms of the quality. They were all normal, but some were better than others. And then they measured NAD content. And what they found was that the guys who had the best quality sperm had the lowest levels of NAD in their specimen, which seems to be like, wait a second, that's not what you would expect, right? And conversely, the guys who had the least good quality sperm, they had the highest levels of NAD. It raises the possibility that maybe the increased NAD is the body's response to poor quality sperm. In other words, the body is saying, hey, sperm quality is not good here. Let's make some more NAD. Let's get some more NAD going in the semen. So we're still working on that question. I think there's still more data to be looked at.
Yeah. And then also longevity, because I want to live until I'm 120. So,
Well,
may-
unfortunately, you're not a fruit fly, or all of the excitement about NAD boosting really was focused on anti-aging,
right.
okay, and lifespan extension, okay. And the first studies that were ever done were done in yeast, and they found that if you boosted yeast's NAD levels, they lived 30% longer. And then they moved up to roundworms, and they found that it was only a 20% gain in lifespan. And then they moved to fruit flies, and fruit flies was only like 15%. And so what we're seeing is that the more complicated the organism, the more complex the organism, the less the lifespan benefit appeared to be. When they got to mice and they gave mice NAD and to see if they would live longer, they didn't. They didn't
Oh,
live long.
interesting.
Yeah.
Oh, okay.
What but there's a different concept, and it's an important concept to focus on. There's lifespan, which means the whole organism is living longer. But then we also have to think about what we call health span. Health span means you're staying healthier longer. And that's slightly different than
Hmm.
lifespan. You may not live longer, but the years that you have, you'll be healthier during those years.
Hmm.
And there's terrific data in human trials on the ability of NAD boosting to improve human health span. It reduces blood pressure, it improves peripheral vascular disease, it reduces inflammation, one study after another. And so the concept of its use in female fertility can sort of be viewed as improving ovarian health span. Your ovaries are going to stay healthier longer.
I'll be taking my NAD then until I am 120, so I can be doing egg retrievals until then. So that is my new goal. I mean, I had a goal about the age that I'm going to be at when I can retire. Now it's going to be extended. So where can people find OVA NAD Plus? Can you just tell us where they can get it?
Sure. Yeah. You can buy it online. It's not in drugstores. Okay. You buy it online at either our website, which is theralogix.com, Theralogix.com. I think it's now actually also up for sale on Amazon, although I think the pricing on Amazon is higher. So those are the places. It gets shipped to you in the mail. It's a 90 count, it's one capsule per day. And so it's a 3-month supply. That's how
And
it's
then Is there a discount code that listeners can use to maybe get a discount from Theralogix website?
I think when you're checking out, if you use the discount code EGG, EGG, I think it drops the pricing about 15%.
Okay, cool. Well,
Your
thank you
take.
for that. You guys heard it here first. So thank you, Dr. Ratner, for joining us. Is there anything you want to add before we sign off?
No, I think we
No?
explored lots and lots of good stuff. And I thank you
Okay.
for having me. And it was great talking to you.
Thank you. Well, thank you so much for joining me today and for sharing your expertise on NAD+, Sirtuins, and fertility. This is a very exciting area of research, and I know our listeners will appreciate learning more about how science is continuing to move forward in ways that may one day help improve egg quality and fertility outcomes. If you enjoyed this conversation, don't forget to subscribe to the Egg Whisperers Show wherever you listen to podcasts and follow along for more expert interviews and fertility education. And if you'd like to ask me your own IVF questions or egg freezing questions or questions about fertility in general, join me at my next IVF class at eggwhispererschool.com.